This video discusses caseload versus workload. It is very common for speech-language pathologists in the school system to experience burnout and attrition. What are burnout and attrition? Attrition involves gradually reducing the strength or effectiveness of someone or something through sustained attack or pressure. In other words, this means someone becomes worn down. Burnout is the physical or mental collapse caused by overwork or stress. This involves someone breaking down and quitting. So why are so many school-based speech-language pathologists experiencing burnout and attrition? Some of the reasons include burdensome paperwork, no time for planning, collaborating, or meeting with teachers. Additionally, there are not many opportunities for individual services. One of the main reasons speech-language pathologists experience burnout and attrition is because of a high caseload. Caseload is the number of students served by a speech-language pathologist or audiologist. The caseload maximum in Kentucky is 65 students. In order for a student to count on a speech-language pathologist caseload, they must have an individualized education plan. This means that students who may be receiving response to intervention services or being assessed do not count on the caseload, even though the speech-language pathologist still has to do work for these students. With a caseload approach, other responsibilities an SLP has are not taken into consideration. The SLP schedule only includes direct services. An example of a schedule under the caseload approach is this. As you can see, it looks like the speech-language pathologist is not doing anything on Friday, and it looks like they could provide services to more students. However, this is not the case. In reality, on Friday, the SLP is trying to fit in the other responsibilities he or she has. A workload approach includes all the direct services and all other professional activities the speech-language pathologist or audiologist does. Direct services include identification, evaluation, and direct intervention. Indirect services include assessment, paperwork, contacting parents, planning, observing, pre-referral interventions, collaboration, supervising, technical assistance, third-party billing, and so much more. An SLP needs to collaborate with teachers, occupational therapists, physical therapists, or any other professionals that could help the student. A speech-language pathologist may be supervising another speech-language pathologist during their clinical fellowship year. An example of technical assistance would be teaching other professionals about an AAC device the student has. A speech-language pathologist's schedule reflecting their workload can be seen here. As you can see, this shows administrators that each day is full of work and that there is no time for additional services. A workload approach helps speech-language pathologists and audiologists better comply with the Individuals with Disabilities Education Act, also known as IDEA. Some of the provisions included in IDEA are a free and appropriate public education for all children, education in the least restrictive environment, access to and connection with the general education curriculum, a collaborative therapy approach, and enhanced parental involvement. Each of these provisions require additional time and planning. A caseload approach does not take this into consideration. Speech-language pathologists serve students with complex needs that may require more frequent and intensive intervention. A student with an articulation disorder will require less direct services and planning than a student who has autism and is nonverbal. A caseload approach does not consider the severity of a student's disability. However, a workload approach takes this into consideration. There is a 12-step process to switching over to a workload approach. The first step is to switch from a caseload to workload mindset. Step 2 involves analyzing the current work week and defining the workload. This is where the SLP determines everything they need to accomplish during each week. Step 3 is where the SLP asks themselves, do I have enough time during the work week to accomplish all the duties I have? Step 4 involves analyzing the needs of each student. Step 5 is to look at the current schedule and fill in all available time slots with indirect and direct services. Step 6 is to attempt to have balance in the categories of curriculum-related activities, administrative tasks, direct intervention, and associated student-centered activities. Step 7 is to identify when all time slots are filled. Step 8 involves identifying the problem if there is not enough time to complete the necessary duties. Step 9 includes identifying those who can help with the problem and help brainstorm possible solutions. Step 10 is to finalize the plan. Step 11 involves piloting the plan for 1 year. Step 12 involves analyzing the plan and seeing what worked and what did not. Overall, a workload approach is much better than a caseload approach. By switching to a workload mindset, the burnout and attrition experience should decrease significantly, and students can receive the services they deserve.